going to do a whole spine thing to show you just some principles that have to go on with the neck. A lot of people think that it is based on completely muscle control, muscle function, but the spine is the neck. You know, the neck's just the exposed part of the spine. So in lots of ways, you have to do the whole thing just to get the control up on top. So a couple of moves that I like to do, right, is just to start to synchronize all of it. So you can start with the chest cavity first of all. Now, when I say chest cavity, as I go into the chest cavity, I'm slightly lifting the neck from behind. So I'm not right on the profiles, I'm to the side that I'm on. But what I hope to do, or what I'm trying to entice to do, is looking at the rib cage like a basket. Now, like, Frank doesn't bend the way I'd like him to, but look at this as counterbalance. So if I put pressure on the lower rib cage, the upper rib cage is going to move. So very similar like with this ball. If I touch him here in this, see how he counters and lifts from the back, right? So it's the same pretense when I'm working on the rib cage. I'm expecting that lift to come right in the upper thorax, right in this area. And that's an area where people have a lot of problem with, even you and I. So we constantly think we have to lift our head up, but a lot of it's coming from the upper chest cavity. So as I'm lifting behind the neck here, and I just start working on the rib cage, and I'll start going through all these ribs on both sides, almost like I'm catching on them. So you can go this way where the fingers are gliding down over, or you can actually go this way where you're doing a slight pull.
You're pushing towards me, or you're pulling towards you?
I'm working on the vertebrae, almost acting like a seesaw. So my objective underneath the spine, the underneath part that I'm not touching, is to get a seesaw to start happening. Because that seesaw is what sitting up is. The seesaw tilts down, this is the pelvis, as the body comes up, and vice versa, and it gets that control of the upper. Versus me being here trying to lift, right? So when I'm working here, I've got my hand underneath the neck, and my other hands are on the chest cavity. But I'm looking really to facilitate the lift in this part of the back, upper back. So just think, for every action you're doing, where is that counter? Where is that seesaw part? And this too is something that get experience with, is you'll start getting input more from the ribs here into the ground versus just lying straight through. Now, if you want to change the trajectory of this, the hands remain the same, but now you can also move the way you approach, and that will also change the movement on the spine. But you can even see with Frank, he's starting to respond more and more as I work on him. This is the funny part with this dumb skeletal system. But you just don't want to go right on the sternum kind of thing.
Yeah, the sternum is great.
And then you can start taking the right hand as it gets more room underneath and go through the top part of the vertebrae along where the scapula is. So again, you can either do it from this kind of thing where your intentions are on an angle, or the same thing here, you can be here and still work underneath.
I want your head to be straight.
Don't worry about her head. She can move it around. Yeah.
She can move it. And she has a tendency to always put it to the right side.
Right. Now, if she's looking to the right, I'm going to do Frank to his left, though, just to get almost the same. So when you're getting a little bit of a lift just because of the head turn, you can put your hand right underneath the base of the shoulder and then just do here where you're getting that twist, but don't think so much of where the ribs are going. Think of the twist again in this area of the back, that it's starting to twist more here.
Uh-huh. Okay. So it's kind of like to make the spinal cord being able to move more.
Right, not only to move more, but these vertebrae, if you look at the profiles, I'll show you from here, they go all along the back. But just think, these are like little seesaws. So the vertebrae need to do this, you know what I mean, as well as the spine going up and down. So as Misha's head tilts and stuff, she should be able to counter those movements. So the more information you're giving her about that counter, the better that the spine should respond to, quote, holding up the head. I believe. Is you can start going down her tummy a little bit with the same intentions with the hand at the base of the neck. But when you're pressing into the stomach, don't think again that you're manipulating or doing anything like this to the stomach. Think just like this ball is doing, that you're pressing into the vertebrae to get the neck to lift up. There, you can see starting to move much more, don't you think?
Uh-huh.
Yeah. Do you see how that's like the beginnings of sitting up?
Yeah, her only problem is she lets her head hang really heavy down.
No, I know, but, you know, it's all hopefully will come.
Uh-huh.
Now, again, since she's your daughter, you can go all the way down into the lower abdomen. I usually say stop, you know, if it's a full-grown person, I don't really go below the pant line or... And then same thing too, you can now change your angle as well, where you're going down and around the abdomen into the head. Or I shouldn't say into the head, into the neck.
gonna learn to sit up all by yourself there.
Now you don't have to move just yet, but I am just to show you. So staying still with the right side of the neck, and now I feel much more comfortable. Now this you might enjoy because you can stabilize the head. I like that my arm stays against the head versus being away from the head. I like, so the head gets feedback from my vestibular. I just try not to keep this arm stiff in any way. And then from behind, on the right side of the neck where I've been working on Frank, which would be left, is I slowly start to do the lift as I'm pushing the rib cage down towards the opposing foot. So in this case, I'm working from the right to the left foot. And to do that, I stay very close to the sternum to get more of that tightness. If I was going, let's say, more to the left arm, then I can go, more of the palm out to the wrist this way, kind of thing, where I'm on the exterior of the chest. But right now I'm going for the foot. Can you see now how nicely that rib slides and all that on the left, on her? So if you want now, switch your hands just to feel what it's like to do the opposing side and feel the difference in how her chest cavity responds. Can you feel that, how it doesn't go to the vertebrae? Yeah. And now go back to the way we were working and you can see just the difference. See, even her breathing instantly changes when you change back to the other way. And then once I get past the neck, I can start going underneath, in between the vertebrae and the scapula again to get to those ribs. So right now, this is probably the most useful target that I use. It's very hard to get into the first three ribs, especially that first rib. It goes way under the clavicle into the base of the neck. So I stay pretty tight to get that twist through the back of the ribs. So in the back sometimes too, I might almost pull up a little bit while I'm sliding down so I can get more of that twist of those upper three ribs versus just lifting up and then sliding. Both moves are valid. That's more of a lifting up and sliding, and then the other one is pulling. So I'm looking for more of a tighter rotation through the upper chest cavity. Now when you're doing something like this too, especially with the child, the thumb can go underneath the scapula to the shoulder rotary cuff, and you can start working on the separation or the lifting of the shoulder as well. But with your hand here, it keeps or the arm, it keeps the head quite stable in this position. This kind of move too is very essential if the person was going to sit up, especially over to that elbow. You want that tight organization between the first three vertebrae. If this is stiff, especially if the eyes are used to looking back like she does, it's much harder to come up like that.
Uh-huh.
Then the head turning and then twisting over. So now I'm going down towards the lower ribs. Now for this, I don't like the weight of my hand on the body, just especially for someone like the weight of the hand in this kind of movement is too heavy, I think. So you need to lift your hands up so only the fingers go on, but you can still have the arm against the head for stability that way. Again, you're not going right on the sternum, you're staying off to the side. So then I'm just going to go under her head a little bit. Just a real nice cupping. I'm not looking to lift the head. I'm just cupping around the head to keep it again stable. And I'm just going to start lifting approximately C1 and then go all the way down the neck. So I'm just going to be, just to activate it. My touch is like this. I'm just lightly lifting. But again, like I've just showed before on the ball, that light lift, see how that movement transfers down.
Yeah.
Right now I'm working right here. So here meaning back of the skull to right where the vertebrae hit. It's easy to catch because there's a big nodule right here where C7 is at. You'll feel a bump.
Yeah. And from that point you lift.
But you literally don't want to do too much, because if you do, the head will go back and you'll get more of this arch, which you don't want. You're just looking to initiate the bone function versus going so severe that you get a movement, especially like that. I don't want this. If anything, if the head wants to react, especially in cases like CP, keep the head where you're cupped with it more, so when you touch and if it goes to move back, then with the cupping you're bringing the head just a little bit forward. But when I say I'm bringing the head forward, I'm not lifting the head, I'm actually scooping back a little bit so that the jaw will drop down towards the clavicles. But I'm not looking for that big of a movement, so I'm just going back to just... It's almost like tuning a piano, thinking of a long string with the vibration. You're just going a little bit, so you're getting the long vibration, and you're starting to just shorten it as you go down. And then notice too, if there's anything that feels odd, stay with it. If it still feels odd, go back to where you felt the tonus being nicer, smoother, looser, whatever your vocabulary is, and then go back and see where that odd part was. You might not be realizing maybe her C3 is out a little bit to the right. You know, things that you're just not used to being sensitive to, and you're going to start picking up on that. You know, just be open to her telling you a story in a sense with her neck. And now as I go back up the neck, I'm going to do something a little bit different. I'm going to look for like just a little bit of the teeter-totter. So I'm going to just raise it up a little bit from the right and then a little bit from the left. Obviously it looks more dramatic with the ball. I'm not looking for that. If I was just on it, you'd hardly even tell that I was doing. Now you should see more movement on the side that you've worked on. Excuse me. But also too, when I'm doing this, I'm not looking for teeter-totter per se, where I'm going right, up, left, you know what I mean, type thing where it's quick. I'm just looking more like the boat is swaying back and forth versus this kind of movement. And this ball is interesting because that's how a human back almost should look like from behind, where the scapula comes down lower and then the vertebrae comes in, creates a little bit of an indent. But again, lots of people are more, you know, like this anyway. And I'm talking about the vision from here.
Uh-huh.
And now I'm just going to go back and to this movement where my hand's on the right and my fingers are just on the upper left, and just see if that feels any better. But see, this is the nice part too about working on your own kid. You can spend literally a whole hour doing just the one side and just very gentle. You know, versus having an hour lesson with someone that you have to do this and 5 other things. Now at this point too, you should be able to slide on or put pressure on your left hand or the chest hand, and then lift underneath to get lower in the ribs as they attach to the vertebrae.
She's making a pretty nice movement from here now.
Yeah, you should feel it. Like just change your hands again, what you've been doing, to go the opposite way and feel the difference. You should really feel some nice chest work. So just put your right hand on top and just feel the difference.
Yeah.
And then go back to what we're doing.
Yeah.
Now this too is where those balls that you're used to using for the therapy you do come in handy, especially for the munchkins. You can also put the balls underneath there to lift or keep the position more tilted. I'm going to use more of a mat for him because he's bigger. But now that he's tilted a little bit, you can go back now and go up and do that neck again with the rib cage. Because what this is doing here now, what people don't realize, and this is really one of my tricks, just being in this position, the vertebrae are going to be heavier and more rotated. You can see it more in his abdomen towards the left. So even though I'm still might be going and sitting, it's still a different type of experience for the body and the trajectory versus the vertebrae like this and doing it. You know what I mean? So this is where I can be very, very slow, 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 do all these movements in this position, this position, this position, this position, this position. So the interior here of the vertebrae are getting that movement and experience of a lower weight or a higher weight, however, again, your vocabulary is. So looking at the vertebrae, or I can do it again with my ball. So the vertebrae is straight up, it has this experience, but as it starts to turn, even here, the profiles are going to be facing this way, almost like imagine an airplane, just going, kind of thing as the kids do. It's the same kind of experience that a typical kid's moving around and around. These profiles and the vertebrae are getting that kind of vestibular movement, and I don't think we play with it enough, especially when we've got someone that's special on the table and is not used to those kind of movements, especially the synchronized, the smoothness of it that they can experience. So again, I can slowly start raising more and more, propping, and just literally be doing the same movement again. So that's the hardest thing too, is a lot of people go, what, you just did that? Well, I did, but I didn't. It's a different experience. But this is essential for crossing midline. The sternum has to cross over for the arm to cross over. If the sternum stays straight up, that arm won't do anything. So it's the whole, to get to the rolling over as well, that we're working on. And the more functions that the body can do, the better the head will respond, or the neck, and everything that you, quote, want to happen. Now again, I'm going to go to the part where I was holding the head and just offering, but I'm going to do the side that's higher. That's going to get more influence. Meaning that the pressure from my right hand in this position is going to be just slightly greater than the pressure from my left hand. And you might not always see it, but just from all that work too, you should be able to feel that the person can go to the left so much easier now, or that opposing what direction that you were working on versus to the, even Frank to the right is just not as nice as to the left because I've been working on it. So even here, I'm going to bring him back to where he's tilted. I'm going to go back on his side now. Now, since he's tilted, notice I'm still back on this rib versus being all the way over here. If I wanted to go all the way over here, I'm already past my leverage point. So I want to stay still here. If I'm going to go that far, then I would want to either adjust my chair where I'm rising. I'm going to come up a little bit to the table. And so again, where my leverage point is where I'm giving the chest influence without being too heavy on the chest cavity here, because I don't want to squish.
next to the spine, no?
Yeah, you can do it through what's ever comfortable for that person. These are when you have to be a little bit smarter. Do they have a scoliosis? Do the scapula stick out a little bit? You know what I mean? So whatever's a good leverage point that you will start seeing the skeletal system naturally roll versus being propped. Like, I don't want to see like an elbow jacked up kind of thing. You know what I mean? I want it. So if this arm starts getting stiff, then at the same time you might want to prop, let's say, with the ball as well here underneath, so it's just more comfortable. And then I'm going to go back and ride the neck again. I'm going to start down lower around C7, which is here right where the first vertebrae attaches to the first rib. And then I'm going to go back all the way up to underneath the skull. And again, if you feel any kind of glitches or there's a hang up in the neck somewhere, just stop and then even possibly just go underneath the rib cage back here, cup it, and just see if you can torque the lower rib cage. You're gonna do here, right, is I'm asking you here to torque here, in a sense to torque here. So by torquing the lower chest cavity, you should actually be pulling or putting into an extension the whatever vertebrae that in the neck that you happen to be working on. So, for example, like on me, right? So if I twist, so if my hand is here and I'm twisting right here, it's actually going to elongate all of the rib cage here, fan it out to extend to wherever I'm touching here. So I can actually ride up my neck and here. And this is something that I'm used to experiencing. Does that make sense?
Yeah.
Okay, good. A lot of people, if they can't get movement, stay where it's at. And if something happens, think outside the box. Either maybe rotate the head more so the spine is going to, it's going to force at least the top part of the neck to twist a little bit. Or again, go backwards onto the neck or come underneath. And again, like I said, I find the torquing that rib cage. So with the torque, the fingers that are closest to the vertebrae are going to go up while the thumb slides down. So the extension of the ribs, see, and it goes. I use this move a lot. I can do it on the iliac crest. I can do it through the femur and the trochanter. I can do it a lot of different ways. But again, don't concentrate so much on this hand. Think of what's happening between the two. And again, you can go up and ride that neck. Now, after doing all of that, that's when we can start actually doing more what you wanted. I'm going to cup underneath the head, and I'm just lightly going to, now whether I have to have the whole neck or the head, depending on the, how that body's responding to your touch, I'm going to start doing that whole movement again. But notice I'm not lifting the head. I'm just gently moving the head up in counter to the rib cage. I'm never going to move the head more than I'm moving the ribs. Does that make sense?
Yeah.
And this is really nice too with that torque. I can torque my thumb back of skull and I can go underneath that rib cage. And what that's doing also for the first time, it's opposing. So see how the jawline on Frank is coming towards me as the sternum goes away. And that's a really nice move. It feels good to almost anybody that this gets done to, because of what that's asking to do is not only is it twisting or opposing the chest cavity with the head, which is something that she's not used to doing because it's a higher counterbalance, but it also, the ribs will start twisting more those vertebrae in a counter rotation. But that move there is when babies are literally on their elbows, you know what I mean, and can reach up for a toy. No problem. Because see, my chest cavity and so forth is going to my left hand, while my head's going to my right. As a more complex version of what you're seeing. And with this too, you should have a lot more room that you can start getting more underneath that scapula or into the shoulder. If they start getting tired, you're just going to bring them back down, and then you're just going to bring that head and towards you. This is a good time to work with vision. Again, it's your daughter. You can give kisses, work with feeding skills. If you're working more with the feeding skills, real easy, just coming underneath the arm at this point kind of thing, and you can direct the arm with the chest cavity, let's say. Use your body more with that. I mean, I'm just throwing out quite a few different examples. You don't have to try them all now. Where you would actually make the hand stationary and work with your movements that way. I like more function. Maybe this is a good time too. You can put a ball in or something like that they're playing with. The ball is great because, again, it rotates, rolls around the chest cavity. Frank doesn't want to hold on to the ball too much, but again, just as examples. Especially if they're doing any kind of self-play, but if you're finding that the head doesn't want to come to you to bring the eye contact kind of thing, this is where you might want to get in just a little bit. You're going to go right above the teeth in the jawline, and just, not that you're bringing the head towards you, but this is where you want to tweak, and again, add that little bit of rotation. And so what this will do, I can see it clearly on Frank, but instead of just having this vertebrae come to you, left, right, you just see where, again, it's changing the visual plane and the tweak of the nose. So again, I'm not looking same, I'm looking to go, and then it'll bring my eyes, jaw, palate, all of that work. into a different level of function. You can even come just gently under the jaw. And again, I'm throwing a lot of things out here. I'm probably giving you like a week's worth of stuff here, you know, right at the end here. So again, it's not something that needs to be done. So I'm just cupping the face quite nicely. I scoop and just bring. But this will help you start to working on that pronating. There you go. See how nice that to work on that pronation of the head and the neck? Now, if you want to bring it into feeding, you can put a little bit of peanut butter or something on your thumb, whatever works. And as you're pronating, then right at the end, like as a kiss kind of thing, you can go in and just add the input. Or if you're getting them to stick their tongue out, you know, where you can touch the tongue or anything like that to work on the inside of the mouth in a sense with this movement. And by all means, if you need to prop her on this side while you're doing this, you know, underneath, that's fine too. And so with all of that, you should feel you're almost grabbing, not the sternum, the point of the sternum, but you're underneath, and you should be able to get just a little bit underneath the rib cage, and just again, the spine should be twisting quite nicely at this point, because even Frank's enjoying it. So, but you can see I get very close at this point. If I was back here trying to do this, see, Frank doesn't even move at a pretty. My rate of movement or my descent is just as important versus again where I'm sitting and how I'm doing. Now, I'm not saying back here is not a valid movement, especially if I was bringing this big guy into sitting. I need to be away from him, but I'm just, you know, putting this out there that you can start applying this differently and always thinking ahead. Sort of like driving, you know, you might know how to get home, but there's always a stray dog or something that's going to run in your, you know, change your plans. Any questions?
No.
But before you get her up, even when we're done, sit on the other side and feel what it's like of how the other side of the chest feels versus the side we just worked on for an hour.
Okay, yeah.
But right now, she should just feel almost like a pool of liquid on the one side.
She's more flexible.
And if you notice too, she's looking at you, which normally, like you said, she has a hard time coming on that side.
Yeah.